I'm really excited to be here today. This is not the first thing that I've opened. I've opened a secondary school near where I live. I've also opened a birthing centre and also a frailty unit. So you're my fourth thing to open, so that's really exciting for me. Today I'm going to tell you some stories, really. I think teaching is all about stories, particularly in medicine and nursing. We can learn so much from our patients and their stories. So I'm going to tell you mine. Can anyone spot me on this picture? Kind of here with long hair. And this is on my graduation day from Edinburgh University 10.5 years ago. A very proud day for me, beginning my career in medicine, my service to the NHS, my lifelong ambitions, really. And that was a very special day that I shared with my parents. This was June this year, so 10 years later, and an awful lot's happened to me to get to this point, meeting Prince Charles and picking up my MBE from Buckingham Palace. And I'm going to kind of tell you how all that happened. So it's July 2011, and I'm a happily married woman. Chris is my wonderful husband. We've both got careers that we love. I'm in my third year of training as a medical registrar, specialising in medicine for older people. Chris is working his way up the management ladder at Asda. We've got a beautiful home, great family and friends, no money worries, and enjoying life, probably working too hard and playing even harder. And we decided we were going to take a holiday to California. We're very lucky that Chris has family out there. So we went out to Santa Cruz and did a little bit of travelling around San Francisco and Yosemite and things. You'd think from that description of my life, I'm on a wonderful holiday and I've got no worries in the world, that my life's absolutely idyllic. But for the fact that the moment I got off the plane in California, I just didn't feel very well. Got this kind of niggling right-sided back pain that just won't go away. And I'm starting to go off my food and I just don't feel well. I can't put my finger on what it is, but I'm being your typical doctor about it and just ignoring it, procrastinating, taking a few paracetamol and hoping things will go away. But they won't. And eventually it's Chris that takes charge of the situation and decides that actually we had to get some medical attention. So I was dragged kicking and screaming to the nearest emergency room, where I thought I was being a complete hypochondriac, but they took one look at me and said, "Oh no, you're really poorly." So they did some blood tests, gave me some pain relief, sent me off for some scans. And it was there that they found out that I was really, really very unwell. My kidneys had failed, and the reason for that was that my abdomen and my pelvis were chock-a-block with tumours. They were blocking my ureters, causing an obstructive renal failure, and I was really very unwell. Bang, out of the blue, a cancer diagnosis at the age of 29. It's quite a lot to deal with. We were thousands of miles away from home, having to communicate everything on the phone to our family, and it was really tough on both me and Chris. Luckily, the urologist managed to save my kidneys by popping some stents into my ureters and got my kidneys working again. So then I took the decision that actually I wanted to come home and pursue my further investigation and treatment with the NHS, because I was confident that the NHS was going to look after me. So I was admitted quite soon after that to the gynecology unit with my presumed ovarian cancer, and things went from bad to worse, really. It was every day was a worst case scenario. My stents failed, so I ended up with bilateral nephrostomies, which are tubes that stick out of your back that drain your kidneys directly. So I had 2 bags that were impossible to kind of coordinate, getting out of bed and things. It was horrendous. I had a really severe episode of pyelonephritis where my left drain was just draining pus all the time and it couldn't get the right antibiotics. And during this time, I didn't think I'd ever get well enough for any terms of cancer treatment, and the histopathologist didn't know what was wrong with me. So they knew from the moment they put my biopsy under the microscope that I didn't have ovarian cancer. But when they did look, they were like a bit scuppered. So they told me that I had lots of small round blue cells. So I was a bit disappointed that my tumour was not more imaginatively named. But they didn't really know which small round blue cell tumour it was. And it took them 2 biopsies and a lot of immunohistochemistry to give me the answer. And that answer came 4 weeks down the line. I was obviously well researched on small round blue cell tumours by that point, having gone to Dr. Google straight away. And I didn't want to have the one that came out of my oncologist's mouth. So he told me very gently one day that I had a desmoplastic small round cell tumour, which is a very rare type of sarcoma. It affects 1 in 2 million people. It had already spread to my liver and bones, so I was in a palliative non-curative situation. I had a pretty much 0% 5-year survival. So I was pretty screwed at that point, really. I had some big decisions at that point. What was I going to do in terms of treatment? Chemotherapy works in this cancer for some patients very well, but for other patients it doesn't work at all. So I could have risked messing up the last few weeks or months of my life having medical interventions that weren't going to benefit me. But because everything had happened very quickly and my family were very keen for me to have treatment, that's what we went for. And I had 5 cycles of very intensive palliative chemotherapy. I was very poorly every time. I got severe neutropenia. I needed multiple blood and platelet transfusions. I got a complication of one of the drugs called hemorrhagic cystitis, which just meant I peed lots of blood all the time. It was horrible. But I got through all that and eventually made a decision on actually New Year's Eve 2011, when I decided that actually I think the burden of all this chemotherapy and hospital visits and having no real quality of life was outweighing the benefit that it was giving me. So I decided that I was going to stop the chemo and do one thing, which was something that I wanted to prove my consultant wrong about. He'd said that I wasn't going to work again in the August, and I was determined to prove him wrong from that day. So 3 weeks later, I was back on the stroke unit as a medical registrar doing the job that I love. I was then well for 18 months, give or take a few problems, but from a cancer point of view, really well. And that's virtually unheard of in this kind of tumour. They might have expected 6 months good time, but 18 months was fantastic. I managed to progress with my career. I managed to tick lots of things off my bucket list and really have a very good quality of life until August, September 2013, when things started to deteriorate again. And I knew the signs. I had a lump in my neck. I felt very tired and my pain was getting worse. So I knew what the scan was going to show before I looked at it. And it showed that everything had got worse very quickly. So we had big decisions again to make about, do we go for chemo again or not? But because it was so effective the first time, my oncologist was very persuasive to let me go again. So we had 4 more cycles of chemo, same problems, only this time I started developing problems with multi-resistant infections, which meant more difficult treatments with antibiotics, and it just became a very tough time in and out of hospital. I started to become quite phobic of the place. I got through all that, I got back to work. I even got to the point of acting up as a consultant in my specialty, which was amazing, to do what I'd wanted to do and see my name at the end of the bed and actually be in charge of my patients' care. But unfortunately, during that time, things started getting worse again. And since then, I've had 2 more courses of chemotherapy, 4 more cycles. And I've kind of been in and out of work quite intermittently. I'm back at work now, and I'm hoping to start my proper consultant job in just a few weeks. So that's my story. I've been through all sorts of healthcare. I've had multiple operations on my kidneys and stents. I've had lots of interventional radiology procedures. I've been on gynecology, urology, oncology wards. I've been to A&E. I've seen my GP so many times I can't count. So I've really seen the health service for all it's got, really. The good side and the not so good side. And it's given me a lot of opportunity to sit and think about what is care, what matters about care, what's compassion, why does it matter to me, what makes a good doctor and what makes a good nurse. And all that time sat in side rooms has really helped me to distill what my values are as a clinician. Now, if you're out and about in hospitals, you'll see that it's very trendy and fashionable to have organisational values, and you might see them plastered on posters around organisations. But I think it's important that we think about what are the things that matter to us when we practice in healthcare. And my things are very, very simple. They're not technologically advanced at all. The first thing is communication. When I have a good experience in healthcare as a patient, it tends to be because people have communicated with me really well. When I have a bad experience, it's because people haven't communicated with me well. If we look at complaints in the NHS, the one unifying factor is always because we haven't talked to people well enough. Communication is such a vital thing that we do every single day, and it's something that we all learn about for the rest of our careers. We never get it 100% perfect. You can't tick a box and say you've been to your communication skills lesson and that's that. It's something that we learn forevermore, and we keep learning and keep developing. The second thing that really matters to me is about the little things. Those tiny acts of kindness that we can do for patients every single day are the things that you as a patient remember. They're what you take away from your healthcare experience. So the person who takes the time to sit down next to you rather than looming over you. It's so horrible being laid in a bed in your pyjamas looking like hell, and there's a whole load of people stood around you. You feel like a circus act and really vulnerable. It's horrible. I challenge you to put your pyjamas on, lie in a hospital bed and get your friends to stand round you. It's not nice. The person who holds your hand when you're upset, the person who pours you a drink, those tiny little things are what we remember, and we can all do them. They don't take hardly any time. The third thing that really matters to me is about person-centred care. Now, this is a phrase that's bandied around a lot, but do we ever actually stop and think about what it really means? To me, quite often, I'm not that red person in the centre. I'm somewhere out here. And it feels like people are doing lots of things that are very important to my care, but I'm just on the periphery of it and not part of it. Now, I want to be part of all my care. I'm a control freak by nature, and I need to be part of the decisions that are happening about my healthcare. Some patients don't. A lot of the older patients I look after don't. They're like, just leave it to you, doctor, whatever you think's best. But knowing that about a person is person-centred care. And the fourth thing that really matters to me is about seeing the patient as a person. I'm not just that girl with DSRCT, being referred to as that twice within earshot. Or even worse, bed 7, would you like a cup of tea? It's horrible. Being in hospital is a dehumanising experience, no matter how good the care, because you're away from your home, you're away from your family, you get told when you eat, you get told when you're supposed to sleep. So anything to kind of take away your identity as well is really difficult. especially when you're having problems with body image and tubes sticking out of you and being bald and things, and then take away your name, what are you left with? So these are my stents. They're very important to me. They're a little bit unusual. They go into my kidneys and then they go under my skin and then they drain into my bladder. They're very important because they mean I can live without the nephrostomies, which was such a horrible existence. But they have to be replaced every so often. So I had that surgery in August 2013 and everything went very smoothly. And I went home the same day. Unfortunately, 36 hours later, I started to get rigors and shaking and sort of shivering and a fever. So I was dragged kicking and screaming back to the hospital by my husband, and you kind of see the theme, poor Chris. And this is where the Hello, My Name Is story begins. So I was triaged by a nurse I used to work with, so it was nice to see Katie and catch up with her. But then I met a doctor who was one of the doctors. It was really difficult to extract what his role was and what his name was. He didn't really want to part with that information. He did eventually, but it was hard work. Then a clinical support worker came to put my cannula in and do my blood cultures, and she didn't have a name, barely interacted with me during that procedure, despite me being really quite phobic of needles now, having had so many hundred needles stuck in me. Then a nurse came to put my antibiotics up. She didn't have a name. She didn't check who I was, perhaps more importantly. And the whole time while she was attaching my antibiotics, she was talking to another nurse about another patient. So I might as well not been there. I felt like one of those, you know those clinical skills arms you practice your blood tests on? Yeah, that's what I felt like during that episode of care. Then I met Brian, and Brian restored my faith a little bit. Brian was a porter. He had a name. He recognised I was in pain. He got me an extra pillow and a blanket to make sure I was as comfortable as possible. And then he took extra care pushing me over the bumps in the corridor of St James's Hospital so as not to exacerbate my pain. And the whole time he was talking to me and my husband. It's one of the most horrible things being pushed around a hospital you know very well, knowing that at every turn you might bump into somebody that they'll either blank you because they don't recognise you in patient role, or they'll have a very awkward conversation with you. Neither of which are nice. So Brian just took away all that anxiety and fear. He just took it away by being cheery and kind and doing those little things that really matter. So then I was in hospital for just under 2 weeks, and I met lots of people during that time. And the vast majority of them didn't introduce themselves. Now, this wasn't a problem with just the nurses or just the healthcare assistants. It went from the consultant on the post-take ward round who assumed I knew who he was, to a medical student who came to take some blood. So this got me thinking. And one evening I was talking to Chris about it and sort of reflecting on my observations. I call it passionately reflecting. Chris calls it ranting. And Hello, My Name Is was born. We decided that maybe we should do something. And Chris kind of inspired me that evening by telling me to stop whinging and do something. So we decided that we could use the power of social media and my already significant presence on Twitter and other social media platforms to get people talking about introductions in healthcare, how important they are, what they mean, what they represent, and remind people to do it, to inspire them to change their behaviours. So if you're going to do anything on social media, you need a catchy hashtag, and Chris is credited with coming up with Hello, My Name Is that evening. And this is the first tweet I ever sent about the campaign, and it's just over 2 years old now. I'm very lucky that one of my friends is a graphic designer, so he designed us a logo, so we gave the campaign a visual identity. And as part of that, we included a smile, because it's not just about saying the words, it's about how you say them. It's very difficult to go up to a stranger and say, "Hello, my name's Kate," without smiling. And that smile immediately relieves anxiety as a patient if somebody in healthcare smiles at you. It's amazing how powerful it is. I blogged about the campaign, the blog that Kathy told you about. And I got my brother to design us a website so we could collate our resources and get pictures of what everyone was doing and sort of promote events and other things. And soon I was being asked to write and being interviewed for various healthcare things. This is a piece I wrote in the BMJ. And all of a sudden, I'd given this tiny, simple idea to the NHS, and people just ran with it. The creativity that came out of NHS staff was absolutely astounding. The sort of logo started popping up all over the place on conference name badges. People started putting it on their work name badges, on lanyards, and chief execs were blogging about it. There was all sorts of little campaigns with students, like we've just done with you. The screensavers, all sorts of things, cupcakes, and it spread right across the NHS. The paramedics got involved, the radiographers had a big campaign, the healthcare students were all getting involved. And I went to Paris last year to the Quality Forum. We mainly went to Paris to celebrate Chris's birthday, but the Quality Forum was just before, so I thought, well, I might as well go to that too. And the reason that I was going there was because I'd had a poster accepted in the culture section around hellomynameis, and I was asked to speak in the social media section. But while I was there, I noticed that other people were talking about hellomynameis. So it kept popping up on the big screen, and people kept pointing at me in the audience, and it was very strange. And then other people kept coming up to me during the breaks and asking for selfies and stuff. It was very odd. And I think it was at that conference that I realised that hellomynameis had gone global and really become something quite big. We had some little hellomynameis stickers that we went around sticking on everyone's badges, and I managed to indoctrinate one of my own healthcare heroes, Dr. Don Berwick, who's a quality improvement guru, and he was very excited to hear about the campaign. And at my own hospital at the time was Leeds, so I was training there and being a patient there, which had its own challenges. But I decided that because this experience had come out of a Leeds hospital, that I wanted to make the campaign as big as I could there and make it the flagship place to have hellomynameis. So I went to the chief executive and said, "Julian, can we do something?" And sort of immediately he got the medical director and the chief nurse, and I had the three most important people in the hospital at my beck and call. It was fantastic. And we designed a campaign that was around asking our staff to pledge their support. So it was about asking them to pledge their support to always introduce themselves to staff and visitors, but also recognising that this runs deeper, that it's around respect and dignity, treating people like you would your own family, and that underlying compassionate care philosophy that goes with the campaign. So in return for the pledge, people got their own badge, and then we went round with a camera. Now, if you go around NHS workplaces with cameras, you tend to see people running to get away from you. Not with hellomynameis. Everyone wanted their picture taken, and we collected like over 1,000 photos, which are now going to be a big photo wall as a representation of the support of the organisation. It's also become a big part of their underlying culture. So, you know, we're talking about organisational values. Well, it's become part of the Leeds values, which is fantastic, and it's part of their corporate induction, and the students who come into the organisation learn about it. I've also done quite a lot of conference talks. This is not the first presentation I've ever given. And as part of my talks, we've sort of developed a Compassionate Care Awards together with NHS England, because I think there's quite a few sticks in the NHS and not enough carrots. So this is a care award scheme that we designed to try and celebrate people doing compassionate care amazingly well. So we've just presented those in September for this year. And I'm hoping that's going to be part of my legacy to the NHS and go on for many years to come. I'm just hopefully going to show you a video now of my colleagues at Mid Yorkshire's Hospital doing their own pledges. So that's our little promotional video that we have in Mid Yorkshire to show our support for the campaign. It makes you smile, doesn't it? Seeing people smile. It's very powerful. Oh, sorry. Very powerful smiling. Press the wrong button. So if you have a good idea that takes hardly any time, doesn't cost any money and improves patient experience, then politicians tend to want to get involved. And I feel a little bit like I shouldn't put pictures of Jeremy Hunt or David Cameron up at the moment, given what's going on with the junior contract. But anyway, leave that aside. They have both been very supportive of Hello, My Name Is, and Nicola Sturgeon has been amazingly supportive and even given us some money for NHS Scotland to support the campaign. Not that this is about money at all. If you turn to Hard Truths, which is the government's response to the Francis inquiry, you know, all the disastrous things that happened in mid-staff's hospitals, you'll find a box all about my campaign and all about Hello, My Name Is and its ethos in improving care. I don't know if you can spot some famous faces on that slide. So as part of my bucket list and the fact that my husband is very cheeky, we've met quite a lot of famous people over the last couple of years, and we always get them to do Hello, My Name Is if we can. So we've got Kylie Minogue and Richard Branson and a few other people. So you might think this is gimmicky, but I think it's actually quite good to raise a profile of something. If you get people talking on Twitter and sharing things, then you get people reflecting on behaviour, and that's important. I could probably change these numbers now, because I sent this to Sarah a few weeks ago, and I'm sure we'll be approaching the 1 billion Twitter impressions. It works out about 6 tweets an hour. I hope you've all been tweeting during this talk so we could push that up a little bit. And it's also become a real big part of NHS Change Day. Change Day is around frontline staff making small changes to improve care for patients. So this kind of fits in with that philosophy and ethos perfectly. So it's been a big part for Change Day for the last couple of years and will continue to be so. The 2nd of February was a big day for me. I started my 3rd course of chemotherapy. But before that, I went to the BBC radio studios in Leeds, and I was interviewed very early on the BBC Radio 4 Today programme. And then I did 5 Live breakfast show. And then I went off to the hospital and got hooked up to my chemotherapy. And I continued to be interviewed all day until Radio 2 phoned me and said, oh, we need to talk to you on the Jeremy Vine show if you'd like to come on. I was like, yeah, that would be great. I said, oh, we'll have to do it on a landline though, because your mobile's a bit crackly. And I said, oh, that's okay, I'll ask sister if I can borrow her phone. So I went to Claire, can I borrow your office just to do radio too? And she said, that's the most bizarre request I've ever had from a patient. So there I was, sat talking to Jeremy Vine with my pump, hoping that my pump wasn't going to alarm while I was being interviewed. But why were the press interested? They were interested because on that day, 112 NHS organisations came together, including some in the locality here, to show their support for hellomynameis. It represented 400,000 members of frontline NHS staff. It's an absolutely amazing day. And these pictures just kept flooding into my Twitter. My phone kept dying of battery because it was hot from all the messages. And it was fantastic to see so much support for hellomynameis that day. We trended on Twitter all day, and it really pushed the profile of the campaign up. The beauty of a tweet is that you reach the entire globe. It doesn't just get to the UK, it reaches everywhere. So we've spread right across Europe, we've spread right across Australia and New Zealand, we've spread across America, but also in places you might not expect. So I got a lovely email from one of the volunteers working in Sierra Leone with the patients who have Ebola. And they said one of the things that they'd thought about the campaign was, how can we do this? We've got all these barriers between us and our patients. And they decided that they were going to write their names on their helmets and put a photo of themselves on their protective clothing. I thought that was a lovely way of how people thinking about how to express a campaign in very difficult circumstances. Going on tour sounds kind of rock chickish, doesn't it? But go on tour we did. So this was Chris's idea. We were talking about how we could keep the momentum of the campaign going, and kind of came up with the idea that this is the most powerful way of spreading the message, me standing in front of people and telling my narrative. So we went off and visited 16 hospitals and hospices and community healthcare organisations, covered 2,000 miles, met 2,000 members of staff and had a very successful trip. It was pretty tiring though. And this is us in East Lancashire, CCG, just round the corner. And on that trip, lots of people shared with us the work that they were doing in their locality of what they were doing to promote the campaign. And this is Andy Tyso, he's a dementia nurse at Chester Hospitals. And one of the things that frustrates him is about when people pick up the phone and just say, oh, it's Ward 43, and nobody says their name. And actually, it's really nice when you are a patient, you phone in the hospital, you're stressed or you're poorly, you know, maybe when I have to phone the hospital when I've got a fever after chemotherapy, it's so nice when somebody says their name. So he designed these phone stickers that have gone on every single phone in the Countess of Chester Hospital. And that's been an idea that we shared. I put it on the website so that people could use it elsewhere and sort of develop it. So why does all this matter? Why am I spending my final months of life on this? I believe that in healthcare particularly, but also in life, that an introduction isn't just about that common courtesy that we're taught as children. It's far more about making that connection with people, about just that professionalism to give something of yourself to a situation. Being a patient is very low down in the healthcare power stakes. As a healthcare professional, you're high up. And the reason for that is information. A doctor will know far more about me before I meet them than I will know about them. They'll know intimate details about my life. They will have seen pictures of the inside of my body and seen all my blood tests and lots of intimate details about me. And I might know next to nothing about them. But sharing our name just helps to rebalance that imbalance somewhat. So once you've rebalanced that imbalance, you can start to build a relationship that may well turn out to be therapeutic in itself. So I believe it's really very vital to healthcare, and if you can't get this right, then you're unlikely to get other things right when it comes to communication. This tweet was sent a few months ago, and it made me a bit worried that hellomynameis had become all about posters and lanyards and badges, but if we don't live the behaviour and really believe in it, then there's no point. We can make it corporate as much as we like, but if people don't take it to heart, then what's the point? So my kind of plea to you as you start out in your healthcare journeys and careers is to think of this as the first thing that you're going to do perfectly. You're going to get this right every single time, and the other things are going to follow on naturally. And you're going to pick up your colleagues if you see them doing it wrong, and you're going to spread the message amongst your peers. Because if you do, there are vast benefits for yourself and not just your patients. This is a friends and family test card that was sent to me. This person had just had a minor operation, and they met a few people along the way, and they'd obviously introduced themselves because they knew their names to write on the FFT. You wouldn't believe how proud you feel when you get your first letter addressed to you, thanking you for what you've done for a patient. You walk tall for days. It has an amazing power on your satisfaction with your work. So if you introduce yourself, your patients get to know you, and those relationships build, and then you can get more satisfaction out of your work. Hiding behind the anonymity that the NHS offers sometimes is just not an option anymore. So what does the future hold? Well, my future's very uncertain, isn't it? I'm here 4 and a bit years later when my initial diagnosis was maybe 12 months if you're lucky. Who knows? But I still remain ambitious for my work, and I remain ambitious that we can provide a better health service, that we can all do things in a more compassionate and person-centred way. And I sort of have an ambition for the campaign that #hellomynameis will become ubiquitous, that I'll be able to walk into any healthcare organisation, speak to any member of staff, and for them to be able to tell me why it's important and why they embrace it. So I'm going to shut up now and let you ask a few questions. But just a little plug for my books. It's coming up to Christmas. You might want to ask your family. So all the profits from my books go directly to the Yorkshire Cancer Centre, which is an amazing charity that improves the quality of life for patients living with cancer in Yorkshire. Chris and I have raised £187,000 for them, and I'd dearly like to make that £250,000 before I die. So if anyone does want to read, then please have a look at my website. Thank you for listening.